Good day everyone, I'm Ivan, the moderator for this webinar. I welcome everyone to today's webinar, which is Medicare and Medicaid Managed Care Enrollments 2024. I would now like to introduce our presenter for today, Tony L. Holmes. Tony L. Holmes, CCS, CPC, CPMA, CRC, AHIMA approved ICD-10, CMPCS trainer, is an internationally known speaker and recognized subject matter expert on medical coding, reimbursement, compliance, and revenue cycle management. She is the founder and CEO of Alpha Coding Experts LLC, ACE. She holds multiple credentials with the American Health Information Management Association, AHIMA, and American Academy of Professional Coders, AAPC. I would now like to hand over the floor to the speaker.
Thank you so much for that great introduction, and thank you to all of our attendees today. We're going to be talking all about Medicare and Medicaid managed care enrollments and what that landscape looks like in 2024. So we're going to be talking about the federal healthcare programs, Medicare, Medicare Advantage, Medicaid, what that enrollment process looks like, pertinent updates for 2024. We're going to talk about the most common challenges with these enrollments, some compliance considerations, and then I'll be happy to take any questions that you have at the end of our session today. So Medicare. Medicare is a federal healthcare program, and it is a participation-based program. It was written into law in 1965 as part of the Social Security Act. Medicare is primarily for U.S. citizens that are 65 and older. There are also some additional conditions or situations where patients may not be meet the age criteria but are eligible for other reasons. So Medicare has four distinct categories of coverage. Medicare Part A, which generally is going to take care of inpatient or facility-based care. Medicare Part B, which is going to be most of our traditional outpatient care. And then we also have Medicare Part C, which is basically a blend of Medicare Part A, Part B, and Part D. And then Part D is going to be our prescription or pharmacy benefits. Medicare Advantage is our Medicare Part C, and that is administered through private health insurance companies. And then, of course, we have Medicaid, which is our federal healthcare program that is administered by the states. So each state has a different setup in terms of Medicaid providers, Medicaid eligibility. Primarily, Medicaid is going to be for low-income and indigent populations. In terms of our enrollment, when we're getting our documents together to go through the enrollment process with Medicare and Medicaid, health insurance companies like Blue Cross, United, Cigna, and basically they are contracted by the state to administer the Medicaid program. You can be fully enrolled. You can also be a limited enrolled provider. And then you can also have an ordering or referring status, much like Medicare ordering and referring. So basically with Medicare, we have two options. You can do, for traditional Medicare, you have two options. You have the paper form option, and then you also have the PECOS online portal. I highly recommend the paper forms. If you're going to use the paper applications, you need to make sure you're submitting your enrollments to the appropriate Medicare administrative contractor. Depending on the type of contractor that you are, you could have a different MAC. Medicare directly does not administer enrollment. They contract with the MACs to facilitate that process. With our enrollment types, so the main ones for Medicare are going to be the 855A, which is our institutional provider application. So if you're in PECOS, this is basically what the home screen looks like. Once you're actually in, this is what it looks like. Some really important terminology. So authorized official is going to be access manager, is the newer term for delegated official. Identity and access management account that I mentioned earlier. Another pretty big thing for 2024 within the Medicare program is that Medicare opened the floodgates to mental health counselors and marriage family therapists, so MFTs and MHCs. Earlier I talked about NIPS, so basically you can go into this portal This is a great resource to have. Another great resource is the Medicare revalidation portal. Another thing that I see very common with enrollments is confusion about, especially Medicare, the type of enrollment. So a type 1 entity is going to be an entity that is affiliated with an individual provider's social security number. You've got to submit your participating provider agreement or the CMS form 460. PAR or participating provider means you accept Medicare's reimbursement as payment in full. And then the other common thing that's missed is you have to include in your Medicare enrollment, and most of your Medicaid, your Medicare Advantage, they're going to ask for your EFT agreement. The other thing you want to make sure you're doing, especially for federal healthcare programs, Medicare, Medicaid, Medicare Advantage. The other thing that I wanted to mention is the Medicare application fees. Not everybody has to pay an application fee. There's no application fee for Medicaid. There's no application fee for Medicare Advantage. But for Medicare, certain organizations, provider types have to pay an enrollment fee or application fee. So it's $709 for 2024, and this is going to apply to institutional providers, facilities, skilled nursing facilities, comprehensive outpatient rehab facilities, all DME, POS providers, so durable medical equipment, prosthetics, orthotic suppliers. You also have to pay the application fee, but for medical practices, medical providers, you do not have to do the Medicare application fee. So just keep that in mind. It's not for everyone. A couple of things as we wrap up. So make sure if you're doing those paper applications that you're signing them with blue ink. Make sure that everything's dated. You also want to make sure that you're reviewing these applications, because if you falsify any information on these enrollment forms, there can be really significant consequences. Respond timely to any information requests. Make sure that your taxonomy linkage is correct in NIPS. Thank you so much for your time and attention today. I hope that this has been helpful. Thank you so much, and I hope you enjoy the rest of your day.
Thank you, Tony. That concludes the session for today. And thank you everyone for participating. You may all disconnect now.